I live alone, and I wasn't getting out as much as I used to.
And I knew something was wrong with me, but I couldn't tell you what it was.
Some days I'm just slouch around the house, and do nothing.
So I thought I was just depressed.
And you feel, why me? Why do I have this? Why do I have that?
I was more interested in learning about my health. I can't be there for anybody if I'm not being there for myself.
I'm from East Boston, and I go to the East Boston Neighborhood Health Center. And through them, I got introduced to CCA. And then gotten involved with CCA. I learned about the different workshops that they've had, and I participated in several of them.
I want to welcome everybody back. We're going to start with activity 1, feedback and problem solving. So we're going to report back.
The health education team actually offers workshops for our members. We want our members to take care of themselves and not totally depend on us. This is what the workshops do.
The majority of the workshop is focusing on self-management techniques and ways in which folks can improve their own health by lifestyle modification.
There's a number of the workshops. They bring together people who have similar problems, and they bring in people who will come in and talk with us.
What happens to your blood sugar levels? It goes down, right?
I learned how to read the labels and watch what I ate.
I used to love macaroni and cheese. I used to eat a whole box. Then I read the labels, 8 servings in a box of macaroni and cheese.
I'm looking at carbs and sodium and stuff I never thought of before.
The health education team, they're not in a white coat, they're not in a clinical environment, they have a little more time than they would perhaps at a physician visit.
And they were so good showing us our action plans.
So we're going to report back on our action plans, and we're going to say if we either completed it, if we partially completed it, if we had to modify it, or if we were not able to complete it. And if we weren't able to complete it, we can problem solve.
One of the things in the workshop is developing an action plan.
Each day we made out little challenges, what we're going to do, and then we come in the next time and discuss if you follow through.
One of my action plan was to walk up this hill that I've been trying to walk up. Now, I've been looking at that hill like, yeah, one day I'm going to do it.
Something in a group setting encourages them to complete their action plan because next week they have to actually report.
That empowers them to go further. I think that they have that encouragement in the class that they might not get otherwise.
When are you going to do that?
Monday, Tuesday, Wednesday, and my confidence level is an 8.
If you start slowly and you work up to that, you see the goal is not that bad.
Now when I look at that hill, it's like I'm ready for it because I set a goal to do it.
They're with a group of people who have the same diagnoses, and they can actually talk to each other and has helped them realize that they're not really the only one going through the same struggle.
And then as it progresses, you see them participating, you see them exchanging phone numbers with people. You hear that they're going out for walks because they live in the same community, and they're doing these social activities that they would have never had before.
I got to admit, I enjoyed the socializing more than anything. I think that's important because overall, part of your health is your attitude. One of the benefits, I think, of most of the workshops is learning how to manage your life, how to deal with the chronic pain.
They taught me to have communication with my doctors.
I drink a lot more water. I walk every day.
Taking my blood levels every day.
Well, it's been a miraculous change because I do have more energy.
I've lost 2 dress sizes and I walk 3 miles a day. Now I signed up for another workshop because I liked it so much.
I got hooked.
My attitude has improved. I'm more social, outgoing. I think it has even had an effect on my cat. She loves me more,